Hi, I am Francesca Berti from Menarini Diagnostics Scientific and Technology Affairs Department, and I'm going to present the results of two clinical trials that have been carried out to assess the performances of our GlucoMen deze CGM system. These are the topics of the presentation. So first, we will see a system overview. Then the first study, the CEVAL study, which was the CE mark registration study of the product. And the second one, the Graz study, which is the most recent one. For each study, we will see study details, the objectives of the study, a brief protocol description, results, and discussion. And finally, the conclusions to summarize all the results that have been shown. So the GlucoMen deze CGM is a real-time subcutaneous continuous glucose monitoring system, which consists of an electrochemical enzymatic sensor, which measures the glucose level in the interstitial fluid for up to 14 days. Data are stored in the transmitter and sent via Bluetooth to the dedicated app, which displays a new glucose value every minute. To be noticed that all the reusable parts, which are the inserter, the transmitter, and the transmitter charger, are reusable for up to 5 years, thus making the system highly environmental friendly. The GlucoMen deze CGM has several unique features. A very important one is the needle-free insertion. Thanks to the unique GlucoMen deze CGM sensor technology, the tiny sensor wire is inserted under the skin without a guide needle, with reduced risk of insertion pain and bleeding. A sensor guide snaps into place inside the sensor insertion tool, this one. Sensor is inserted at the press of a button. The session automatically starts when the sensor is inserted. The GlucoMen deze app, which is available for both Android and iOS smartphone, displays the latest glucose value, trend arrows, and the glucose graph. The app also allows the user to perform calibration, which is required once a day, to set and customize high and low alarms, rapid glucose change alarms, and predictive alarms. Data can be shared in real time through a cloud and shared remotely with the healthcare providers or carer. So let's see the first study, the CEVAL study. This was the CE mark clinical validation study of the CGM system, which involved 57 diabetic patients with type 1 and type 2 diabetes. And it was designed as a multi-center prospective open-label study. So the study was carried out in 3 clinical centers in Slovenia, Croatia, and Serbia. The primary objective of the study was to validate the system functionality, user interface, and sensor performance to confirm its suitability for non-adjunctive use. The evaluation of the percentage of success in sensor insertion and calibration in 14 days wear was the primary endpoint. The secondary objectives were to evaluate the accuracy of the GlucoMen deze CGM device versus YSI laboratory references, and to evaluate the accuracy of the GlucoMen deze CGM versus an SMBG reference. So in this case, the endpoints were MRD, MAD, and consensus error grid analysis. So let's see a brief description of the protocol of the study. So 57 subjects completed the studies, each one wearing 2 sensors in parallel. The study consisted in 5 in-clinic days on day 1, 4, 7, 10, and 14. And the period in between was dedicated to home use real-life days. During the in-clinic visits, subjects were requested to stay at the center for 12 hours During each visit, a venous blood sample was collected every 15 minutes and measured with a reference laboratory instrument. The subjects were asked not to intake food for 10 hours before arriving in the clinic to explore the hypoglycemic range. Then they were provided a meal, but insulin administration was controlled in order to explore also the hyperglycemic range. During the home use days, the subjects were requested to perform at least 5 finger prick tests a day at defined time, to manage once per day the calibration by themselves, and to record in a diary relevant events like, for example, shower times, food intake, exercise. At the end of the day 14, the sensors were removed in the clinic, and the insertion area was evaluated for skin reaction for safety reasons. These are the study statistics and demographics. So 58 patients consented to participate in the study, 57 actually concluded the whole study, each one wearing 2 sensors in parallel. So in total, 114 sensors were evaluated. Of these subjects, 55 completed the 5 in-clinic days, so 2 skipped just 1 in-clinic day due to common illness. The subjects were approximately half female, half male, the 84% of them with type 1 diabetes and 16% of them with type 2 diabetes. Nearly half of them were insulin pump users. The average age was 46 years old. They had an average BMI of 25.8 and average HbA1c of 7.4%. So let's see the results. First of all, this is the sample distribution of data pairs during the in-clinic days on the left and at-home days on the right. All the data were collecting over the whole glucose range of measurement of the system, which is between 40 and 400 milligrams per deciliter. First, the accuracy versus the reference YSI obtained during the in-clinic days. And we can see that an MRD of 9.9% was obtained for data points between 100 and 400 milligrams per deciliter, and an MAD of 14.5 milligrams per deciliter was obtained for data falling between 40 milligrams per deciliter and 100 milligrams per deciliter. The stability of MRD over the monitoring period was also evaluated, as you can see in the table below. And we can see that MRD was generally consistent over the whole monitoring period, characterized by a slight decrease between day 1 and day 7, and then a slight increase in the following days up to day 14. The agreement of CGM readings with the reference blood glucose values was also assessed. And we can see here in this table that 74% of CGM data fall within 15 milligrams per deciliter or 15% bias versus the reference value. 85% of data within the 20 milligram, 20% of the reference value, and only 1.5% of the data showed a bias higher than 40 milligram or 40% of the reference value. Here below, a breakdown of the performance in specific glucose range is also shown. The consensus error grid analysis showed that 91% of data points fall in the most clinically useful zone, in zone A, while the combined percentage of points in zone A and B was 99.4%. Let's see now the results obtained during the home use part of the study, where we can see that an MRD of 12.8% was obtained and an MED of 14.9 milligram per deciliter. Also here we can see the MRD over the entire period, so at specific group of days, and we can see a slight increase of the MRD from the first part of the monitoring toward the end, but still consistent with the average value. The more detailed performance assessment of the bias versus the BGM reference is shown in this table, and we can see that 65.2% of the data pairs show the bias within 15 milligram per deciliter or 15% of the reference value. 75.6% fall within 20 milligram, 20% of the reference value, and only 5% of the results showed a bias higher than 40 milligram or 40% of the reference value. From the CEG analysis, we can see that 86.5% of data fall in zone A, and that 98.7% of the data fall in the combined A and B zones. An evaluation of insertion pain was also carried out. So each subject was asked to compare the sensor insertion pain with pain normally experienced for finger prick. And we can see in this graph that the GlucoMen CGM insertion pain has been reported to be very low, on average 1.3 over a pain scale between 0 and 20, which is the Graz pain scale, while as a reference, finger prick had an average score of 4.9. Finally, the sensor insertion site and the area under the adhesive were assessed for swelling, edema, and redness, erythema. And the result that no adverse event represented by a Graz score equal or above 4 were reported, both for erythema or edema, and both at the insertion area and under the adhesive, thus confirming the high tolerability of the system. So the average success rate for sensor insertion, calibration, and 14 days wear was 83.3%, so above the target of the study, which was 80%. This is the Graz study. The study was performed at the Medical University of Graz in Austria by Professor Julia Mader and her staff, who has a long-standing experience of clinical investigation in the diabetes care area. The study was performed as a monocentric prospective open-label study. 8 subjects completed the study, all of them type 1 diabetes on MID or CSI therapy. The primary objective of the study was to evaluate the accuracy of GlucoMen CGM device in measuring blood glucose versus a reference instrument, which was YSI. And the secondary objectives were to evaluate the accuracy of the GlucoMen CGM versus an SMBG reference. So in both cases, the endpoints were the calculation of MRD and consensus error grid analysis versus YSI and SMBG, and also to evaluate the safety and tolerability of the GlucoMen CGM, and to evaluate the overall usability of the system by end users. So this is a scheme of the protocol design. 8 subjects completed the study, each of them wearing 2 sensors in parallel, so for a total of 16 sensors. And after device insertion and brief training, subjects went home and conducted their normal activities. Calibration was managed daily by subjects in complete autonomy, thus allowing to explore a real-world use. For each study day, during the home monitoring period, the subjects were asked to perform at least 8 finger pricks a day at specific timing in the days. The study also consisted in 2 in-clinic visits. During the in-clinic visits, a meal insulin challenge was performed in order to explore rapid glucose excursions. So subjects were requested to stay at the center for 5 hours. At lunch, a standardized meal was served, and then the rapid glucose excursions were followed. During the visit, a venous blood sample was collected every 20 minutes and measured with a reference lab instrument. In parallel, still every 20 minutes, an SMBG test was performed by patients. To be noticed that YSI references have been mostly collected in phase of rapid glycemic variation, so in a more challenging situation for the system. These are the study statistics and demographics. So 8 subjects completed the study, 16 sensors were investigated. The useful monitoring session duration was of 13.2 days on average. Subjects were 5 male, 3 female, all type 1 diabetes, with an average age of 41.6 years old, a BMI on average of 28 kilogram per meter, an average HbA1c of 55.6 millimole per mole, and approximately 14 years as an average of diabetes duration. So let's see the results. This is an example of the CGM profile on the entire 14 days monitoring period. The 2 in-clinic days are clearly visible here, and we can see how the system correctly followed the glycemic excursion. The yellow dots are the YSI reference, while the red dots are the SMBG reference. So first of all, the accuracy versus YSI. This is the distribution of number of data pairs during the in-clinic days across the glucose range between 40 and 400 milligram per deciliter. An MRD of 90.7% was obtained, and the MAD of 20.5 milligram per deciliter was obtained. Here we have also a breakdown of MAD and MRT in the most relevant glucose intervals. The consensus error grid analysis results are shown in this slide, and we can see that 84.9% of the data pairs fall in the most clinically relevant zone A, and that the combined percentage of data pairs in zone A and B was 97.8%. These are the results of accuracy versus SMBG obtained during the at-home monitoring period. This is the distribution of data pairs over the glucose range between 40 and 400 milligram per deciliter. Of the accuracy assessment show that an MRD of 13.1% was obtained and an MAD of 16.6 milligram per deciliter. Also here we can see a breakdown of the results of MAD and MRD in the most relevant glucose intervals. The consensus error grid analysis show that 76.4% of the data fall in zone A, and that 98.2% of data fall in the zone A and B combined together. Finally, the safety endpoints. So during the study, no adverse event or serious adverse event occurred. The sensor was well tolerated over the entire 14 days monitoring period. So we had only one subject that accidentally removed the sensor 2 days in advance after shower when drying himself with a towel, but with no injuries. No severe skin reaction was observed, both at the insertion site and under the adhesive area. Here we have two pictures of the same subjects and the two insertion sites after the removal of the sensor. So, and an overall satisfaction by user was assessed to a questionnaire. In conclusion, the clinical data from the two studies confirmed that the performance of the system in terms of MRD and CEG are in line with the state of the art. So for the CEVAL study, we obtained an overall MRD of 9.9% versus YSI, and an overall MAD of 14.4 milligram per deciliter. 99% of data points fell in the clinically acceptable zone A and B of the consensus error grid. For the Graz study, an overall MRD of 9.7% versus YSI was obtained, and an overall MAD of 20.5 milligram per deciliter. 98% of data points fell in the clinically acceptable zones A and B of the consensus error grid. It was confirmed that the high tolerability of the sensor, so no serious adverse events were recorded. There was a general good tolerability of the sensor and the adhesive, and patients judged painless the insertion of the sensor. As a final remark, the results of the CEVAL study have been recently published on the Journal of Diabetes Science and Technology. Thank you for your attention.